Welcome back to another Rapid Update where we identify, summarize and comment on developments that impact access to new healthcare technologies. We only review resources that are in the public domain. The first update that I want to bring you relates to changes at the Australian Pharmaceutical Benefits Scheme. This is specifically this update over here on the National Medicines Policy. There's a review scheduled to start in August 2021 this year. The specific parts that we thought was interesting for the purposes of this video is the following. So as I mentioned, the review process will start in August 2021, and it will focus on 4 important themes: timely access to medicines that Australians need at a cost individuals and community can afford. Second is medicines meeting appropriate standards of quality, safety and efficacy, and quality use of medicines. And the fourth bullet is maintaining a responsible and viable medicines industry. The first National Medicines Policy was published in Australia in 2000. So this is another incremental update and review of that. These first 3 bullets usually appear on most national drug policies in countries, at least in my experience of the sample of national drug policies that I've reviewed. This fourth component is interesting, and it's suggestive of trying to strike a balance between trade policy and healthcare policies in Australia when they talk about a responsible and viable medicine section. So in this video I wanted to highlight that very specifically, which is this section over here in the current draft of the National Medicines Policy. But let me just show you this resource that's available on the Australian Government webpage, National Medicines Policy, a partnership for better health outcomes. Let's have your objectives, access to medicines, is there quality, safety and efficacy, quality use of medicines. And then this part here, so talking about a responsible and viable medicines industry, it is essential that industry policy, vis-a-vis trade policy and health policy, be coordinated, providing a consistent and supportive environment for the industry and appropriate returns for research and development, manufacture and supply of medicines. International competitiveness will only be achieved if Australian industry can operate in a global environment. So this refers to its ability to export, to import, to be able to act as a meaningful player in the global medicines industry. But it does require alignment between domestic international property protection with international standards and continuation in research and innovation within the Australian market. And finally, the third point under this paragraph was the recognizing the primary position of the patient vis-a-vis its need to access educational materials, consumer medicine information, responsible advertising, in order to benefit the final consumer as they consume medicines. So this paragraph over here will be important to have a look at in the months and weeks ahead. It'll be interesting whether any changes are made. Not anticipating anything in the first paragraph on research and development, potentially something in the second, and also certainly nothing in the third. So watch the space. We'll see how this point evolves. The second update related to a update by Medscheme. They are a large medical scheme administrator in South Africa. They also have operations in sub-Saharan Africa. They administer medicine benefits across a range of different medical schemes, health insurance, private health insurance companies. And their medicines management department just recently released these updates. So a comprehensive formulary, July 2021, specialized drug list, July 20 also this year, and medicines exclusion list, and also the medicines price list, which is here. What's of particular interest to those tracking the diffusion of newer healthcare technologies through societies, this specialized drug list is always useful to keep a track of, and this is what it looks like. So depending on the specific scheme option, products included in this specialized drug list may be funded if authorized by the relevant managed healthcare program offered by the private health insurance company. And products drop onto this list, they drop off this list. So Hemlibra is there, for example. Other examples is Repatha, Prolia is there. amongst quite a few others. So that's a resource to keep track of. And then the final update is jumping into another country completely now in Europe, and this is in Belgium. A recent article published 22nd of June in the Journal of Pharmaceutical Policy and Practice by this group of co-authors focused on the knowledge and perception of biosimilars in ambulatory care, a survey amongst Belgian community pharmacists and physicians. They sampled 177 pharmacists, 30 physicians, asked them a bunch of questions on their knowledge and perception regarding biosimilars, and these were the results. First is only 32% of community pharmacists and 52% of physicians had yet dispensed or prescribed a biosimilar. They noted the insufficient training for these healthcare professionals on biosimilar therapy, which has significantly higher compared to their self-assessed competencies. So it was just insufficient training seems to be the major barrier here to increasing this rate of dispensing and prescribing. And they ended off with a conclusion stating that the study showed a substantial need for targeted educational measures to increase knowledge and confidence about both biological medicines and also biosimilars. The concern here is that if in a country such as Belgium there are such low rates of confidence and insufficient training, is it perhaps also an indication of other European countries facing similar barriers? Likewise in other geographies, Middle East, Sub-Saharan Africa, Latin America, amongst across the entire world for that matter. So this is a perennial policy concern, and certainly an area where a lot more work would need to be done in the future on targeted educational measures to support the diffusion of biosimilars. So with that as a wrap, thanks so much for tuning in. Take care. Bye.